So what are the signs and symptoms of a thyroid imbalance? Signs are what the clinician sees or when you're looking at the person from the outside, and symptoms are what the person reports. And so it's important to differentiate between the two. So let's first talk about the symptoms. The symptoms of low thyroid function are consistent with an overall metabolic slowdown. And the reason I started with low thyroid function is because hypo or underactive or low thyroid is significantly more common than hyper or overactive thyroid. We see that mostly it's women of reproductive age that are affected, which is how I got into this thyroid discussion in the first place with all my clients. It's the underlying cause for many reproductive issues. And we see that most oftenly these conditions go undiagnosed. We often see that someone might think it looks like depression, or it might look like PMS, or it might look like infertility. And people get different types of treatments, but they're actually all related to low thyroid function. Thyroid disease is one of the most underdiagnosed health conditions in the world. Lack of knowledge and understanding of hypothyroidism and a tendency for many people to attribute symptoms of hypothyroidism to other causes have led to a substantial unawareness and often late diagnosis of hypothyroidism. So let's look at what some of those symptoms are. Common symptoms of hypothyroid or low thyroid are consistent with an overall metabolic slowdown. So if we do a head-to-toe review, first impacted is cognitive function. This might look like depression or low mood. If we look at overall metabolism, this might look like inappropriate or sudden or unexpected weight gain or weight that's difficult to lose. It also looks like dry, rough, or coarse skin, hair falling out, feeling chilly or tired all the time, very difficult time getting up in the morning. The person might be dependent on caffeine, like heavily, drinking like 5 or 6 coffees before it's even 10 a.m. just to get out the door. And overall, the person feels very sluggish and tired. This can also look like fluid retention, especially in the extremities. You might see swelling of the arms or the fingers. And overall, we experience a metabolic slowdown. Now, this is related to digestive health as well. So we think about a person's digestion being very slow or sluggish, which is going to impact 2 very important things. Number 1 is the uptake of nutrients, and we've talked about some of those key nutrients already, like iodine, selenium, and proteins. Number 2, it's also related to the elimination of waste, which we've talked about when it relates to metabolism, is that one part of metabolism is how well or how efficiently a person eliminates waste. So sometimes this looks like constipation as well. Now, a person might also have difficulty conceiving. This is related, of course, to the rate at which the reproductive system is working at. There might be, slow periods, meaning delayed menses, or there might be very heavy menses, or there might be a dysregulation of the maturation of the egg. And so infertility is a very common symptom that we see with low thyroid function as well. The other thing I wanted to mention about digestive health is small intestinal bacterial overgrowth, or SIBO. This is a type of dysbiosis, and what we've seen in clinical studies over and over again is that it's highly related to some form of thyroid imbalance, and we'll see SIBO again in hyper as well as hypothyroid states, but I wanted to mention that now because it seems to be a root cause of many autoimmune conditions as well. The last thing I wanted to mention is that because of thyroid imbalance, and we'll talk more about swelling of the thyroid as well, you can have pressure that's placed on the voice box or larynx, causing abnormal throat sensations or tickles in the throat or difficulty swallowing. And sometimes it can even alter a person's voice. So a person might say that they sound hoarser than they normally do. When we look at clinical signs, so remember, signs are what the outside person or the clinician sees. We can look at examining the thyroid, looking for swelling of the thyroid gland, as well as any type of fluid retention that might happen in and around the face. With low thyroid patients or hypothyroid patients, we also see a lateral thinning of the outer third of the eyebrow. We might also see fluid retention in the extremities. Again, the feet and hands might be swollen, or you might see delayed or slow reflexes. So when you do an exam, you might see a very slow reflex of the person. Their extremities will also be cold, and we'll go into that more when we do the physical review. Lastly, I want to talk about diagnostic lab tests, and we're going to do a deep dive into diagnostic lab tests later. But what I want to say is that with hypothyroid patients, you're going to see a high thyroid stimulating hormone. Remember that thyroid stimulating hormone is the pituitary hormone that is signaling the thyroid to produce more hormone. And so when a person is hypo or low thyroid, there's an increased need for that thyroid hormone in the body. So thyroid hormone levels are, TSH or thyroid stimulating hormone levels are high. Now, the person might have low or normal T3 and T4 or thyroid hormone levels, but that thyroid stimulating hormone level being high is one of the key diagnostic indicators of low thyroid function.